there a difference between guys who maybe can't get it up versus guys who simply can't maintain it?
A lot of the time for patients that have a physiologic problem like decreased inflow, diabetes, hardening of the arteries, hypertension, it's an obtaining problem, right? They can't physiologically obtain the erection. There's not enough blood flow going in or too much outflow going out. In my experience, the patients that have trouble maintaining it typically have some other factors. These can be medications, psychological issues, anxiety. All this is kind of interplaying, and it's often complex and multifactorial, and rarely is one the sole cause of decreased erectile function.
So it could be an overlap of a lot of issues.
Usually it is, and so you fix what you can and you address what you can, and your ultimate goal, as I mentioned, away from just looking objectively at the IEF like as a research tool, is satisfaction of the patient and their partner.
And usually it seems like all of the factors are interconnected. So if you kind of fix one, then it's a domino effect.
Yes,
correct?
often just fixing one can be all you need to tip you over to where, you know, there's that satisfied endpoint where you're like, you know what, this erection is working for me, it's working for my partner, I'm pleased.
Are more men with ED suffering from the psychological or physical aspects?
A lot of times, the more you are skewed towards psychological might be your younger, maybe healthier patients, and the more you're skewed towards the physiologic might be perhaps your older patients with certain medical comorbidities or other illnesses as we know, as we age. But even still, it's usually a complex interplay of both psychological and physiologic factors.
What are some common psychological problems that are manifested in ED, and what are ways to deal with that?
Well, so, some of the things that I mentioned earlier, so, you know, depression, you know, one of the symptoms of depression can be low libido, which then can, you know, affect erectile functioning as well. Anxiety, so whether that's performance anxiety or it can just be like generalized anxiety or even panic disorder, all things, or post-traumatic stress disorder, those are all the typical anxiety disorders, and any of them, you know, can really affect sexual functioning, as well as ED can cause anxiety, cause that performance anxiety, and can cause depression, you know, because any loss can cause, you know, can really contribute or cause depression. And certainly that is a loss for men, you know, as they experience their, you know, if their functioning has changed. A history of sexual trauma is something that can sort of manifest itself in erectile dysfunction, you know, and can also cause anxiety around sex. In terms of relational issues that manifest in erectile dysfunction, you know, that could be resentment, it can be distrust, say someone's worried about their partner, you know, having any kind of extramarital activity or, you know, sexual activity outside the marriage that's not agreed to. That can be, you know, something that causes distrust. That can cause difficulties in the bedroom. And then also, as I said, this sort of pursuer-pursued dynamic where, you know, someone can kind of just feel claustrophobic around their partner regarding sex, and that can cause problems.